Hey, I'm Molly Sims.
And I'm Emese Gormley. We're two girls obsessed with one thing, beauty.
And by that, we mean everything that makes you look
And feel
beautiful.
We're calling on our favorite health experts, industry insiders, and friends to answer all your beauty questions.
With a drink in hand.
Definitely with a drink in hand.
You're listening to Lipstick on the Rim with Molly Sims. Sadly, this week is coming to you with the solo by Molly Sims. No, Emese couldn't be with us this week. She's very sad to be missing this week's guest because I have talked about him for the last 2-3+ years. I have one question for you guys. What does Chrissy Teigen, Meagan Good, Jen Atkin, and a few other people who have really, really, really good brows have in common? Well, we asked you guys what you wanted to hear, and so many of you wanted an episode about brows. Now, we're not just going to talk about brows because we can't spend an hour talking about just brows, but we are going to talk specifically for a little bit about brows and all things face celebrity procedures worth considering now. I am so excited. I went to see his counterpart, Dr. Diamond, a few years ago. I was like, what do you think I should, how am I age? He was so great. And he was like, you got to meet this guy named Dr. Jason Champagane. I'm like, who is Jason Champagane? Anyway, I got the pleasure for literally 10 minutes. He came in the room. He was so great. I'm so excited that you're here. Joining us today is Dr. Jason Champagane, one of the Hollywood's top aesthetic facial plastic surgeons, recognized by Vanity Fair. He is the go-to expert for brows, facelifts, neck lifts, rhinoplasty, and beyond, with a specialty in creating natural, customized results that enhance your features, not erase them. I love that. He's the man behind, oh, that's right, they're called the Champagane brows, the expert in hairline lowering patients travel across the globe to see. Today, we're going to be diving into how your eyebrows, your jawline signal youth, the secret to celebrity procedures that are trending right now, what full facial rejuvenation actually looks like, and exact lasers, fillers, and subtle tweaks that are totally and truly worth it. Oh my God, I love you. One day, I'm going to be in that office. I'm going to be sitting in that chair. I'm going to be knocked out, and you're going to do everything. But I do want to start with brows.
Absolutely.
You're amazing. And your name is Dr. Champagane.
Well, thank you. And it's a pleasure to be here.
No, I love you. I love you and Dr. Diamond. Okay. Brows. We're going to take it down the list. How did you get to be known for the brow guy? And why do you think brows are so important when it comes to facial symmetry and perceived youth? And you always say it can actually change your entire face.
100%. Brows, in my mind, when I look at a face, they set the balance and structure for the rest of your facial features. So they help to frame your face. They're so important that there was a study that showed celebrity faces with eyebrows and without eyebrows, and with eyes and without eyes. So the brows were there, but not the eyes. And in reverse, the eyebrows were not there and the eyes were. And people had a harder time recognizing a celebrity face without the eyebrows than without the eyes. And so it just tells you that the brows are that important in distinguishing faces and setting up the balance for the rest of the face, and that they stand out that much and make that much of a difference.
You're known, like I said in your intro, for the Champagane brows. What exactly makes your brow approach different? I didn't even know until Christy and Jen and everybody said that you could even do a brow transplant, I guess is what it's called.
Yeah, an eyebrow transplant is the basic term for it. And of course, we call it Champagane brows in my practice.
Champagane brows.
But the reason my technique is different is I've spent a lot of time, number one, studying brow shapes, brow patterns.
Is this because when you're doing facial aesthetic surgery, the symmetry, so that's what you're studying? Is that how
In
it's...
addition to it, yes, right.
Okay.
So I'm looking at the face as a whole, but understanding that the eyebrows are a part of that. They're a part of your beauty. They're a part of your youthfulness. And so having experience as a hair restoration surgeon, that's how I started my training many years ago, both facial plastics and hair restoration. I took that knowledge from hair restoration and said, and I didn't invent the eyebrow transplant procedure, full disclosure. I just honed my technique and refined it into what I develop and use today, apart from other surgeons. And so refining it and creating that shape and position of each individual hair that defines what an eyebrow looks like and what a natural eyebrow looks like is extremely important. And it's very different than transplanting hair on the scalp. When you transplant hair into the eyebrows, the angle is very important. The exit, the angle of exit from the skin, the flow of how that hair flows over from the middle toward the side, toward the tail is very important. Because it is easy to pick out, in my mind, a poorly done eyebrow transplant. If the hair is placed at the wrong angle or the wrong direction, or they're not flowing together.
That's what we always used to see. That's why no one would do it. I mean...
Yes, and so I did something about that,
Now they're called Champgane brows, and I get all the business, and everybody flies to see me. Yes,
but for me, it's using my skill set to help so many people, and that's what makes it so valuable for me overall, is helping people in their everyday lives. And it makes huge differences, and it's surprising, the stories that I hear. And so that's what makes it worth it for me.
I have to say, I know Chrissy Teigen. I love Chrissy Teigen. She is freaking gorgeous. She got an eyebrow transplant. I'm like, she doesn't need an eyebrow transplant. I was sitting there talking to Dr. Champgane a second ago, but honestly, she looks maybe she didn't. It's amazing. Yeah. And Jen was like, change my face. Like they look so natural. I might do it one day.
It's on your face, right? So it has to look natural. It has to look like you. And you don't want something that you've thought about doing for years and all of a sudden it's a disaster.
What's the most common mistake people make with their brows, whether it's shaping, lifting, overfilling, doing the, bad tattoo that, some people, what was it called? Microblading?
There's microblading.
Microblading, yeah.
Yeah, which, I have my opinions on, but a lot of my patients have done and come in because they're not happy with their results. But the biggest mistake I would say people make, there are a couple. Back in the 90s, the biggest mistake was over-tweezing, I think. And some people still do that, but I think we've sort of gotten away from that, which is a good thing. So number one was over-tweezing, over-waxing to where the hair doesn't grow back. And then you're left with very sparse brows or unshapely brows or asymmetric brows. The other one nowadays, the mistake is if you are penciling in your brows or you're manicuring your brows, you're making the mistake they're not balanced with the rest of your face. So let's say you have smaller eyes and your brows are too big. Right. Or you have bigger eyes and your brows are too small and they're not framing your facial features well. To me, that's one of the biggest mistakes that people are making with their brows.
I think I saw like that whole fad of microblading. I'm like, girl, that's just a bad tattoo, right? Like that is like, I'm like, what are you? And then they go to some random, I'm like, what are you doing? It's on your face.
Yeah, it can be problematic, and look, there are good technicians and not so good, and artists who do a good job. But in the long run, many times the microblading fades or it bleeds into itself and becomes just one solid block or turns colors. And so for a lot of people, it's not the best option.
When a celebrity walks in your office, a lot do. I've seen them there. I love them all. It's like literally going to Craig's in Beverly Hills. Once a refresh, how often do you find it actually starts with brows?
It's one of the parts, yes. And it's fairly often, especially in a certain population, let's say in their 40s or 50s, in that time frame that they
What are you talking about? We don't know those moms.
I don't know anybody like that. But those who grew up in the 90s and over-tweezed or over-waxed, certainly that's one of the starting points. And like I said, because it sets the balance for the rest of your face, and it can age you.
Yeah, let's talk about that. I have a question. We talk a lot about aging around the eyes. What role does the brows play in kind of making someone look a little bit tired or older than they should be?
So there's a couple things. One, as we age, and one of the first things that we start to notice is what we call ptosis of the brow, which is a drooping brow, or it starts to get heavy. So as we age, our collagen starts to deplete, and we don't reproduce as much collagen and elastin in our skin, so it starts to thin out. The musculature, everything starts to get heavy, gravity starts pulling down, and we start to see ptosis or heaviness of the brow. And that will age us because it starts to make us look like we're tired, and even though we're fully refreshed. The other thing is sparse brows, or over-tweezed, over-waxed, or maybe you never had a lot of brow, especially on the sides of the brow.
Okay, that's what I know you're looking at them. That's what I want. You are. Don't worry. I'm not going to look at you during this interview, so you're not going to look at my brows. But if you were to look at me, you would be like, that's where I've lost hair. I take so many crazy supplements. I'm like a queen of supplements, but I have noticed like the thinning just at the very end and like a little bit on top a little bit.
Yeah. As we age, most people do tend to lose hair starting from the outside in a little bit. And what happens there, similar to a receding hairline, or let's say you're thinning at your hairline, it makes you look like you're aging. So when you start to lose hair on the tail of the brow and it starts to expose that brow bone, people recognize that, not intentionally, but they see that, and it can, in their mind or in your mind,
she looks a little older.
You look a little older, or, you're aging. And so if you reestablish that brow, a fuller brow, and start to cover over some of that brow bone, it creates a more youthful look.
You know that feeling when you're doing everything right, eating clean, getting your steps in, hitting your water goals, but you still feel off? Same. That's honestly why I started taking Symbiotica. I was so tired of wasting money on supplements I thought were doing something, but couldn't actually tell. Symbiotica's changed that. These are high-quality liposomal supplements, which basically means your body's able to absorb them. Total game changer. Okay, let me tell you what's in my rotation. I'm obsessed with their magnesium L-threonate, which helps with focus, mood, and sleep. I take it at night, and it's like my brain just powers down in the best way. Then there's the glutathione, which is amazing for skin and digestion. I've noticed way less bloat, and my skin is actually glowing. And for summer, I just added their new Irish sea moss. It's lemon vanilla flavored and supports digestion and energy. I'm also obsessed with their liquid colostrum. It's been amazing for my gut, my skin, and even my hair. Honestly, taking my supplements has become one of those quiet little rituals I actually look forward to, and it just helps me feel more like me. Go to Symbiotica.com/lipstick for 20% off plus free shipping. That's Symbiotica.com/lipstick for 20% off plus free shipping.
A patient comes in, they're like, I'm doing it. We're going to pop champagne, no pun intended, right after. What do we do? Will you come in for a consult?
Yes.
How long does it take? What's the downtime? Tell me everything so I can come in your office next week.
For eyebrows, ideally, it's an in-office consult. However, especially with our recent pandemic and online consults have become very popular, I can do a lot of virtual consults, which is great because I have a lot of patients from around the globe. And so initial consult, we can start virtually. And I still would like to see you in office to examine your hair type, the quality of your hair, because I do borrow hair from typically the back of the head. So that's where the donor hair comes from. So it starts with a consult. Want to make sure you're a good candidate. Well, who's a good candidate? A good candidate is going to be a patient who has healthy hair on their head, number one, donor hair, who doesn't have a history of trichotillomania, which is a disorder where you have a habit of pulling your hairs out, because you have to be treated for that first. So that wouldn't necessarily be a good candidate. Right. And we kind of rule that out in the beginning. Good candidates for the procedure, if you think about eyebrows, they tend to have a little bit of curvature to them. Mm-hmm. So they grow out from the skin, but then tend to slope back towards the skin.
Yeah.
So really straight hair and really coarse straight hair is not ideal, because if you're using that type of hair from the head and transplanting it into the brows, no matter how hard I try to get those hairs to lay as flat as they can toward the skin, they're never going to curve back toward the skin and look completely natural.
Okay, this is probably a really dumb question, but do you ever use like donor hair?
From someone else? No, it doesn't work.
It has to be from you, right?
Yeah, it doesn't work. I mean, theoretically you could, but think about an organ transplant patient. You have to be on immunosuppressive medications. There is a fear of rejection. If you were to use someone else's hair, your body would reject it the same. So no, unfortunately, we can't do that. I've had that question many times, and it's a good question, but unfortunately, it doesn't work.
And how long does it take? What's the downtime? Because I talked to Jen about it. I'm like, it wasn't who it was, another patient. I can't remember who it was, but I'm like, that's all it was. Like, people have this misconception that it's like days.
Yeah, no, right. And some people say, can it all be done in one day, or is it multiple days? It's one day. It could be a long day depending on how much hair we're transplanting. So if we're doing, and this happens fairly often, a full brow where some patients have nothing and they just pencil in a brow every day, those procedures can take anywhere from 6, 7. The longest I've done is up to 8 hours.
And are you fully under?
No. So most patients, it can be done.
I will be fully under.
It can be done under anesthesia, but it's not necessary. Most patients, 99.9% of patients choose the non-anesthesia route. Oral Valium, I give Valium by mouth to relax you. It's an anti-anxiety medication, but most people kind of drift in and out of sleep through the procedure. And I keep you comfortable. I use local injection anesthesia, similar to going to the dentist and having a tooth pulled. They numb your teeth. It's the same idea.
And so you transplant the hair in, and then what happens after?
So the hair is transplanted. We borrow hair from the back first. And then that donor hair gets transplanted one by one. Now, I personally, I borrow the hair. I make all of the little incisions in the skin. Each hair needs its own incision at the right angle, at the right depth.
So you're an artist.
The right flow. I think it's an art. And I used to draw a lot as a kid, and I think a lot of that plays into what I do nowadays. But it is an art to create an eyebrow. I mean, you have to think about the pattern of an eyebrow. And so that's why doing it right and doing it well is so important to get those results. But each individual hair is transplanted one by one. And then we were talking about that curvature. So if you have, we didn't finish, but talking about patients who have wavy or a little curl to their hair are the ideal candidates. Because that hair will have a curvature to it. And when we're transplanting those hairs, I make sure that those hairs are all turned to where that curvature is flowing the right way. Because of course they could turn this way and grow away, but we make sure we spin all those hairs. I make sure we spin all those hairs that they're flowing in the right direction.
And what is the downtime?
Downtime, 5 days is the most critical downtime.
That's it?
Yeah, 5 days. The first 5 days after the procedure, you're going to have a little bruising and swelling around the eyes. No significant pain. The transplanted hair is not sealed in place for 5 days. And so that's your major downtime, where I recommend not touching your brows at all. We put a little bit of antibiotic ointment in the brows. It helps to hold everything in place. It reminds you not to touch it. And then you wash your brows on day 5. The hairs are sealed in place. They're seated in place at that point, not going anywhere. And then it's safe to wash and go about your daily business. And it's pretty simple. Now,
and that's it.
That's pretty much it. There's some crusting in the brows that falls out around 10 days. The hair sheds. The transplanted hairs shed at about 2 to 3 weeks. And then you get permanent new growth starting around 4 to 5 months after the procedure. Best results are at 6 to 8 months.
I know we haven't approached it, and I can bring you back on. A lot of men now are getting PRP, and then they're getting PRP, stem cell, and then adding in hair. Mm-hmm. Why is this now come back bigger than ever?
Hair transplants? Mm-hmm. I think there's been a lot more social media, for one. I think there's been a big push and focus on hair.
Have you personally seen more patients?
I have, yes. And I have seen more patients who are interested in maybe going abroad for procedures.
I know everybody you hear, I'm like, why are you going to Turkey?
Yeah, I would recommend doing a lot of research. I would say not maybe a great idea to for medical tourism, to other places. We have a lot of good surgeons here in the U.S. And our requirements are, could be a little bit different, but be careful, because in places like that where there's a big social media push to go to this place, there's good and there's bad, right? So
also you just have to really research it and make sure the regulations are, up to a certain standard.
Absolutely.
Are there any non-invasive treatments, lasers, threads, PRP, that help restore that brow fullness that you're like, okay, a patient is like, I'm just not ready yet? Is there some, I know it doesn't replace it, but are there any like tips that you could do at home or come and see you with PRP that might work?
It's limited, unfortunately. I would say, look, if there was this amazing like pill you could take, everyone would know about it and I would be out of business, right?
Right.
But there are a few things. At home, I would say, don't tweeze, be very careful with what you're doing as far as that goes. The newer, there's lamination technique. I would say don't do that too often. I mean, you can.
Why?
It can damage hair potentially. If you do it very often. It's a safe procedure, but
well, that became a total viral trend as well. The brow lamination.
Yeah, and it could be done, but I would say don't do it too often. Other things would be like in office, I do a treatment that can tighten your skin, so we can lift the brow a little bit with the skin tightening procedure. That's
Can we discuss this, Dr. Jason?
Absolutely. So it's an advanced radio frequency skin tightening device, and it's one of the newer things that we have in the office that helps to tighten skin. So not only the brow, we can lift the mid face, so the cheek, give it a little more tightness here, and lift the cheek.
And there's no threads, needles.
No, I'm not a proponent of threads.
Can we talk about it, because you hear such different sides of the coin on this topic of, do I do a thread? First of all, explain to our listeners what a thread actually is.
Threads it's basically dissolvable suture. Some have barbs, others have slightly different design that anchors to the tissue. So it's placed just below the skin and it has little anchors on it. So when you pull it, it can pull areas tight so that you can lift the corner of the mouth, you can lift the brow up and out. The issue, and they are dissolvable, the issue is that they're very short-lived. It's been said that they can last months to years. In my experience, they're much shorter lived than that. As a surgeon, I can achieve a much better result and a more long-lasting result with surgery than you can with threads. And the issue that we've come across, a lot of us surgeons are talking about—
I know what he's about to say—
is scar tissue under the surface. And we've seen a lot of patients who come in and say, I've done threads so many times, I've done other procedures, and it's just not working. It doesn't last very long. I'm ready for surgery. When we get in there and we start a facelift, there's a lot more scar tissue in there, which is a little more challenging and puts you at more risk, because there's important structures in your face, nerves that control your facial muscles, those sorts of things. So I'm really not a fan of the threading technique.
Let's talk a little bit about, I'm going to go through, celebrity, procedures that really aren't so celebrity secrets anymore, because everybody's telling you everything, which is what we love. What are some of the most requested tweakments? Meaning like procedures that, people are asking for that are kind of on the newer end of what's out there.
Well, I'm starting to get more requests for what we were talking about, the advanced radio frequency skin tightening. That's a newer, it's been around for a while, but we have some newer devices that are really good. Some of the older ones had a little more risk of fat loss and volume loss in the face, and so your skin could sag a little, which was not great. I don't use any of those devices, but the newer ones are really good at dialing in just to the right layer of skin so it tightens skin and doesn't risk the volume loss.
And what's your downtime on that?
Minimal. There's no skin injury. There's no healing time. So you look a little flush in the face for a couple hours from the heat.
I'm doing this.
It's just a topical heat basically, and it cinches your skin, but it stimulates collagen production. So you can go back to normal activities. You can wash your face right after.
Okay, what are some of the most requested Tweakments?
So that one, the radio frequency skin tightening. Another one that's, it's out there, but I do get, it's like a little minor adjustment of the nose. It's a little bit of filler, a non-surgical rhino, we call it. And it's just a little bit of filler in the nose for the right patient who has little irregularities, maybe a little hump or just a little ptotic tip and just needs a little bit of tip projection. You can do a little bit of filler in the nose for a little bit of a tweak, and it makes a big difference in profile photos, or if you have a photo shoot coming up and things like that, or you're getting married, those things. And then other in-office procedures. I call it Champgane radiance, but it's a procedure where I use a very mild CO2 laser in office.
My girlfriend just did it, and actually, I'm like, what did you do? And she's like, I did this like baby CO2, and this was, I think she was on her third day. You couldn't see anything.
Right.
I was like, what?
There's different levels of CO2 laser. In the past, what most people thought of as the really aggressive, under anesthesia or painful peeling. Your face is sort of raw appearing for a few days, 5 to 7 days, and it leaves you with an amazing result when it's all said and done, but there's a little more downtime. This one is, like I said, a mild CO2, very low energy, resurfaces your skin, but there's not that aggressive peeling. I've done this myself many times.
Your skin is great.
Oh, thank you. We have all the,
should be. You
we
are
have all
a
the
plastic surgeon that does face work, but
right. I have the keys to the candy store.
Exactly.
Right? But I've done this many times. I've done the advanced radio frequency skin tightening myself several times. But the mild CO2 laser treatment exfoliates the outer layers of your skin and leaves you with a brighter, more dewy appearance to your skin. When you combine that with PRP and PRF layered on top, it helps to improve your collagen and elastin production. Your PRP and PRF, which PRP is platelet-rich plasma, PRF, platelet-rich fibrin, has your own growth factors, anti-inflammatory cells, adult stem cells in it. So it helps you to heal quicker, reduces that inflammation, but gives you those longer-term results.
I did microneedling about, like a year ago, and I didn't have time to do the PRP. I'm like, just do it, with my derm with Holly. She's like, you really should do the PRP. I'm like, I don't have time, whatever. She's like, you never have time, I know. But wow.
It's an important step. It really
By the way,
really
I should have done it. The microneedling took me like 3 or 4 days as opposed to 1 day. I was shocked at the downtime. It was fine. I was just but I can see, I really saw the difference in not doing the PRP than when I did the PRP.
Yeah.
Fillers, right? So Botox seems to still have, a good name. Mm-hmm. People are stepping back from filling.
Fillers recently, and in the right amounts and in the right hands, a filler is still a good option.
Right.
In moderation. Let's say moderation. Because what we've seen is too much, right? Overdone.
Well, I think that's what's great about you and Dr. Diamond. You actually tell people no.
Yes.
I know. And, I think that's why, either you like you or you don't like you, because word on the street is like, I'm not doing that.
Yeah. In my practice, it's a conservative, refreshed look. I don't want you to look overdone. I want you to look like you, but just a better, improved, enhanced you. And something that's going to benefit and balance your facial features. Give you a little volume back, but nothing overboard. And then at some point, fillers are not the answer. The answer does at some point, if you're interested in that, become surgery.
Okay, let's talk about it.
Things
when to do it or not to do it.
Yeah.
When do you do it?
It's
and also break it down, the facelift, because now the facelift is not just the facelift. Do you have the mini? Do you have the half? Do you have the brow? Do you have I think that's where everyone is getting a little overwhelmed. Okay, where are the scars? What's the mini? When do I do it? More and more women, are doing it earlier in life.
It's a personal decision, number one. It's also a conversation with your surgeon. Pick a good surgeon, do your research. So I would say it starts there. It varies. Genetics play a big role in aging. Environmental exposures, sun damage, those sorts of things play a role in aging. And so some patients can benefit earlier than others. And then some patients just aren't ready at certain times. And then it just depends on that time frame. And then others are just never going to be into surgery. And so that's okay too.
Do you think you should do it before the shit hits the fan?
In my experience, and I've been in practice now 12, 13 years, being preventative early on is the best way to go. Doing little things, number one, skincare, avoiding the sun, SPF when you go out in the sun daily, reapplying it, and being on a good skincare regimen is going to do wonders for your skin through the years. After that, and we talked about a little about Botox, a little bit of Botox is good at a certain age, early 30s to mid 30s, maybe a little earlier than that, depending on genetics.
To start for prevention.
In very small conservative amounts to keep the muscles from moving aggressively, but you should still have facial movement. You should still be able to emote and do all of those things and be able to scowl at your kids if you need to, but not as aggressively to where those wrinkles, those deep lines start to form. And so being preventative and helping reduce the formation of the deeper lines, reduce the aging of the skin, so keeping your collagen production good. And that can be minor in-office procedures like we were talking about, the mild CO2 laser, the advanced radiofrequency skin tightening to stimulate collagen and keep your skin tight, will help to prolong that time to surgery if need be. So I think being more preventative and educating yourself.
Let's talk about jawline. It's like a big thing now. People are talking about neck, jaw. What are some things that people are doing? I mean, I've heard people are even like shaving like the neck and the jaw, something like that. I don't even know. I couldn't even read it.
Not quite as popular here in the States. It's very popular overseas where they're doing a lot of jaw shaving for feminization of the face and things like that. And a lot of women are doing it to streamline their face. But here, one of the things that I'm doing in my practice is customized 3D implants. And so we're taking 3D CT scans of the skull and I'm designing an implant that will fit specific to that patient. So everyone's bone structure is different. Everyone has a slight asymmetry potentially, or they need a little bit more volume, a little bit more projection. And because everyone's unique, they do make standard implants that are 4 different sizes, small, medium, large, extra large, but they don't fit great.
So you do customization.
Customized implants, where this 3D CT scan allows me to design an implant that will fit your bone structure perfectly and only you, like a puzzle piece. So if you feel your jaw, everyone, you can kind of feel a little notch. Some people have a notch and some people have little irregularities along the bone. Maybe not so much you, but
I'm feeling my jaw.
but many people do. And so what we do is we can customize that implant to project your jaw angles and crisp up the jaw angles, make them sharper, a little more 90 degrees, give you better projection, correct any asymmetries that you may have. And
everybody's asymmetrical at some point,
no one's perfectly symmetric. Yeah.
How hard is it for you to tell a patient that you're not going to do it? We're not going there.
Not too hard. I think it's very important to be honest with my patients. And that's always my approach with my patients is to be very honest. And if I think you're not going to benefit from it, if I think it's too early and it's not something that you should be doing right now, I will tell you that. And I think that's very important for patients to minimize harm, to minimize risks. And maybe they just need a little bit of education as to other things that we could do before surgery or before things that they may not benefit from.
Can you walk us through your approach to facelifts? Is it deep plane facelift? And again, I know it's very personalized and very tailored.
Yeah.
But what's the difference between a facelift and a deep plane facelift?
Again, semantics.
Semantics.
Yeah. The deep plane facelift is a buzzword right now. In fact, on my way in here, I saw a post about it. What's the deep plane facelift and why is it so popular right now? The deep plane facelift is a technique that's been around for many, many years, like 20 plus years or longer. And all it is it's an approach to a facelift that goes a little bit deeper under the tissues to resuspend and reposition the musculature and the tissues of the face. So there's different layers in the face. There's skin, there's fat, there's what's called the SMAS. The SMAS is I can say the word, but it's super long and it would be very scientific.
Don't worry, I love SMAS.
But the SMAS is the short word for it. And the SMAS is that layer similar to the platysma muscle in our neck, the one that you had a little Botox in that tightened things. That muscle extends onto the face. And so we can't really move that muscle. It's very thin, but it's a continuous layer. And that's the layer that we dive under and into some deeper tissues during the deep plane facelift. And utilizing that layer, we can tighten all the facial muscles along the medial part of the face, toward the middle of the face, that will give you that refreshed look, but we're not putting tension on the skin. And so the deep plane facelift is used for certain types of patients who have really aggressive drooping of the middle part of the face, or the jowling, and you have to extend it a little further out. There are other facelift types. You might hear the vertical facelift. It's just different kinds of approaches,
semantics.
but they're all very similar. There's the mini facelift, and some of these are just different words that people
And the
are
mini,
using.
what would be a mini?
A mini facelift, in my mind, is just not as aggressive. You're not going as far out because it's an earlier facelift, maybe for patients who don't have a significant amount of jowling, but they're starting to see some dropping. But again, it's semantics, and everyone's individualized. So I don't go to a certain point on the face for everyone. It's all individual. As far as I need to go, that's what I'm going to do. And so I don't even call them mini facelifts or deep plane facelifts. It's just whatever approach I need to use for you is what I'm going to do.
Future, where are we going? What are we doing?
Man, so
I have to say, I am seeing less filler. We talked about that a little bit. Like the cheekbone chipmunk look, like, oh my God, and they start in their 20s.
yeah, over time, if it's overdone, it starts to look very unnatural. Typical fillers are humectants. They hold on to water. So a humectant is something that holds on to water. Hyaluronic acid, it's found in skincare because it helps to plump your skin. It moisturizes, it holds on the water. So when you use filler over time, you can end up looking very full. You've seen that moon face appearance where it just looks distorted and bizarre. And that's just overuse of fillers, and unfortunately providers who just don't know when to say when. And I think it gives fillers a bad name, number one, because fillers, like I said, they're still good, but in conservative amounts and for the right patient. And at some point, a filler is not the right answer, because filling doesn't resuspend at some point. It doesn't give you that volume. It just is like inflating a balloon. What you need to do at some point, if you're looking to do that,
Deflate the balloon and cut.
Tighten things, right?
Tighten.
Resuspend. And not when I say tighten, it's not like that overdone crazy look. It's more of a conservative approach, but you look 10 to 15 years younger and refreshed. And your friend should say, man, you look great. Like,
you slept.
Were you on vacation?
Yeah.
That's what they should say.
What about lasers? Anything you think that besides the tightening one that you like?
Well, I'm using laser therapy for hair growth.
Really?
Yeah. So there are some laser treatments for hair growth, both in office and at home use. And so that's out there. Maybe not as well known. I mean, in the hair world, it's known. And for patients who are losing hair, it's known, but maybe not for the general public.
Do you see it starting to work?
It does work. It helps with blood flow in the scalp. It helps to improve vascularization. So some of the laser treatments, the ones that I recommend that are FDA approved, help to increase the number of blood vessels in your scalp and also dilate the blood flow in your scalp. So you get more oxygen and nutrients to your scalp. If you're taking vitamins for hair, it helps to deliver those vitamins to your scalp a little better.
Can men and women both do that?
Absolutely.
Oh, I want to do that.
Yeah, husbands and wives can share it if they want.
Done. Stuart and I are in. He's going to get some hair and I'm going to get some laser.
Yeah. And the laser is dialed in specific to the follicle, depth. It's not, a lot of people say, well, doc, is it going in my brain? It doesn't go that deep. It's not harmful. Again, the ones that I recommend are FDA approved. And they have been shown to improve thickness of your hair. It doesn't grow hair back where the follicle is gone. So if it's dead and gone, it's not coming back. But if you're starting to see some thinning and those hairs are starting to weaken, you can definitely reverse that process somewhat and thicken your hair with the use of a laser treatment. Other in-office treatments, advanced radiofrequency skin tightening is not a laser. We didn't mention that, but it's not a laser. And so again, for your skin type, safer because it doesn't have that risk of the laser
Right.
on your skin.
Do you love what you do?
Absolutely. Like every day. It's not work for me.
Is there a favorite thing you like doing?
Champgane brows is one of my top. I really enjoy doing rhinoplasties too, noses. Those are fun. I think that's also because it's an art. Everyone's really unique.
Okay, we're going to do a little rapid fire.
All right.
Botox or filler if you had to pick one.
Botox.
Coffee or matcha?
Coffee.
One trend in aesthetics you hope never comes back.
Oh, for me, easy. The over-tweezed brow. I mean, that's easy.
I think we know that. Champagne brows. Okay. What's your guilty pleasure?
Occasionally, I like to get up in the middle of the night and have ice cream.
Love it. Are you an early bird or night owl?
Early bird.
I'm you're a surgeon. I
I'm
clearly
in
know
bed
that answer.
very early and up very early.
What's your favorite cocktail?
I like a non-sweet margarita. So a skinny margarita with a little bit of spice to it.
Most used app on your phone?
My most used app is my notes app. I make a lot of notes to myself to reminders and for sure.
Favorite part of your day?
Favorite part of my day is my morning routine. I have a specific morning routine that sometimes I go to bed at night excited about.
What's your morning routine?
I get up, make my coffee. I listen to a little bit of music.
Love.
I make a little breakfast, and it's just getting me started for the day.
Go-to comfort food?
I would have to say my mom's, and I don't know if everyone's going to know what this is, but we call them butter beans in the South.
Yeah, of course. Where are you from in the South?
Some people call them lima beans.
I call them butter beans.
But we call them butter
Yeah.
beans. I'm from just south of New Orleans.
Oh, I'm from Kentucky.
Okay.
We call them butter beans.
Okay, well, good.
But you could also call them lima beans. Cook dinner or order in?
I like to cook.
I love it.
Yeah.
We always ask every guest before you go, if you could give advice to your 10-year-old self, what would it be?
Don't give up. I would say don't give up. There was a time when it got a little like in college where getting into medical school can be a tough road and daunting, and the testing and everything and studying. But I would say don't give up, because it'll end up great. It'll all work out.
You're amazing. You guys have to follow Dr. Jason Champgane. Just like it says, Champagne, pop a glass for him right now. I love it. And make sure, if you guys listen, he does take patients all over the world. So, he and Dr. You guys are incredible. You guys are such a good team. I love what you both do. I love you. And I love these episodes because literally like every year something is new. And like we get more questions. Rosie has gotten more questions about brows in the past, 12, 18 months. Like people, it's becoming, it's like the eye thing and then the brow, like it's really,
thing. It's a thing.
And even the hair transplant, right?
Absolutely.
It's not becoming, such a stigma anymore.
And I like seeing that, because why? If there's something that you can do for yourself that helps you in your day-to-day life. I mean, look, I go to the gym, I work out. A lot of people work out. A lot of people, you go to the dentist to keep your teeth looking healthy, right? Why not do something for yourself in a different way? Eyebrows, hair, anything that will help you feel better about yourself or get you through your day-to-day life. And so do it.
I'll see you next week. I'll see you next week, Dr. Champgane. No, but you guys, love you, listeners. I'm sad Emesha's not here. She would have loved you. We will see you next week. Make sure and follow us at Lipstick on the Rim. You can follow Emesha's Substack. Tell me more. But again, thank you. It's always such a pleasure to, I feel like a kid in a candy store. I'm like, what can I do?
My pleasure. This was so much fun.
You're the best. Thank you. We will see you guys next week.
Thanks for listening to Lipstick on the Rim with Molly Sims and my ride or die, Emese Gormley. We are so excited to bring you guys along on this journey with us. You can find us on Instagram and TikTok at Lipstick on the Rim and at Molly B. Sims. Or you can go to my blog where you can dive just a little bit deeper into my favorite products, trends, and more at mollysims.substack.com. And don't forget to check out our video episodes on my YouTube channel, Molly Sims. This podcast is a production with Sony Music. I wanted to give a special thanks to my team, Rosie Cummings, Kenna Ryan, Sophie Kevorkian, and everyone at Sony Music.
Don't forget to listen and follow wherever you get your podcasts so you never miss out on the fun.